When I choose to operate on a patient, I really take that decision to heart because plastic surgery is an elective procedure and you don't have to have the procedure. I have the ability to operate on someone who's healthy and have the also unfortunate ability to cause a problem if it's not properly executed. So the first thing is proper patient selection. When I do that, the key is for me and you to reach common ground and to be able to communicate appropriately. That's the first way that I avoid a risk and complication in plastic surgery. The next thing is there are a lot of things that you can do. Smokers are at higher risk for complications, so I always encourage my patients to stop smoking, and often I won't operate on patients who are smokers because I don't want you to have a complication. Sometimes that's to my detriment because I might lose a patient, but to me that's just not worth having a complication. Another thing is I want patients to be close to their ideal weight prior to any body contouring procedure, because if you're not and you lose weight after a body contouring procedure, you can have looseness again and you could be unhappy. And I always want my patients to be happy. Another thing is that I want my patients to have limited other medical problems. If they have diabetes, we have to really consider if it's safe to undergo a procedure. Often diabetics can have very well controlled blood sugars. Other things are, I don't want you to bleed. I always screen my patients to see what medicines patients are on. Often people don't realize that herbs such as garlic or ginkgo or supplements such as vitamin E and fish oil can actually make you more likely to bleed with surgery. So we always discuss with patients how to avoid those complications by making sure they're not on those medicines, and we have our anesthesiologists see patients before also to decrease those risks. When I perform surgery, I try to do things very atraumatically, and what that means is to be very careful and to not hurt tissue when performing surgery, because the more delicate and careful I am, the more likely you'll heal. But unfortunately, complications do happen, and even to the best possible surgeons. And that's what's important when I see my patients, is to let them know that I'll be there for you because I really do care. When my patients have trouble, it keeps me up at night. And so I just want all of my patients to be well, and I do everything I can to make them well. And when they have trouble, I will address it. Sometimes patients have to have revisions also. Thank you.